Hey guys, welcome to my YouTube channel. In case you have not subscribed, please subscribe. If you have done so, thank you very much for your support, and share my video, like and comment, and also don't forget to turn your notification bell so that every time I post a video you will be the first one to be notified. So today I want to talk about something that is always very common in women, and that is urinary tract infection, and that in short we call it UTI, urinary tract infection. And you get that most of the people who are mostly affected are women, and this is because of their urethral anatomy. It is always short from the anus to the along the urethra to the bladder. So you get that the bacteria has short distance to travel from the anus to the bladder. So in short, I want to talk about the signs and symptoms of urinary tract infection and risk factors or causes of urinary tract infection. And straight away I will start with risk factors. Who is at risk of getting urinary tract infection? As I have said earlier, a woman is most at risk of getting urinary tract infection compared to men. This is because of their anatomical formation. Another thing that is also put one at getting urinary tract infection or UTI is these conditions that lower immunity, such as diabetes. When you have diabetes, your immunity will be low, and this will put you at risk of getting UTIs. And another thing also, when you are pregnant, when a woman is pregnant, immunity tends to be low, and it will put a woman at risk of getting UTI. So, and also sometimes those women who are sexually active, when a woman is sexually active, the chances of getting UTIs is increased compared to a woman who is less active. And also when, let me say, those who are having many partners can have UTIs more than that person who is having one partner. And also another thing that can put you at risk of getting urinary tract infection is some contraceptives such as diaphragm. It will lower your immunity, or it will expose you, not lowering your immunity, but will interfere with the circulation of hormone in your body, and this will put you at risk of getting urinary tract infection. And also another thing that will also put you at risk of getting urinary tract infection is long use of catheters. That is, to those who are staying with catheters, the catheters should be exchanged after every 2 weeks, but sometimes you get that because of low income, because of so many things, poor financial whatever, can make someone to stay long with catheter without going to the hospital to be changed. So at this point, this person will be at risk or will get urinary tract infection. And another thing that will also put you at urinary tract infection is when you are having kidney stone. It will block the flow of urine, so you will get that urine is blocked to pass out, and then at this point you can be at risk of getting urinary tract infection. The most causative agent of this urinary tract infection is E. coli, and that is Escherichia coli or E. coli, we call it that in short. And some of the virus and the fungus also can cause urinary tract infection. And straight away to the signs and symptoms. How can you know that you have urinary tract infection? Some women or some people will experience the vaginal itching or the genital itching, and this will confirm that sometimes you are having urinary tract infection or UTI. And another thing, when you are having urinary tract infection, you can have persistent frequent urinating. You go and pass urine, small amount of urine frequently, and this will show you that you are having urinary tract infection or UTI. Also, a persistent urge of urinating also can be one of the signs and symptoms of urinary tract infection. Sometimes you can have smell urine, or you can pass cloudy urine. At this point, you can sense, or you should go to the hospital and get tested, or go to the hospital and get tested to know if you are having urinary tract infection. And also another thing that can make you that can do what, that you can know that you are having urinary tract infection. You will be having lower abdominal pain, or let me say pelvic pain, mostly around the flank and the lower abdomen, and sometimes at the back. This is because sometimes the infection has affected the kidney, so you can feel the pain on the flanks. That is the side, your sides, the left and the right side of your abdomen. Or if the infection has affected the bladder, you will always feel the pain at the lower abdomen or around the pelvic. I think those are the most signs and symptoms, among others. Those are the most signs and symptoms that somebody can have to sense that this person, you are having urinary tract infection. And if you experience such signs and symptoms, please make sure you go to the hospital so that you can be treated, because there are so many complications that can come when you are not treated well. Thank you. Let's meet in my next video, and don't forget to leave your comments there so that I know what to make a video on next time. Thank you very much for watching.